So today what we're going to do is show some stretches for flexibility, and then we'll progress into some core exercises for strengthening of the back. So the first thing we want to think about when we're stretching is both the back side of the leg and the front side of the leg. And so Tiffany's showing us a modified hurdler stretch, which is stretching the hamstring muscle, the posterior thigh muscle. That attaches to our pelvis girdle, and if it gets too tight, can pull and rotate the pelvis, causing added stress on our back. So to do this stretch, we're going to seated comfortably on the floor with our opposite knee, foot into our opposite leg bent with the foot at the knee. And she's just not going to lean over and try to grab her toe, but just sit in a nice posture, leaning forward slightly, trying to reach above her toe. Remember, we don't want to do too much forward flexion and rolling or rounding of the back, because that can add stress on the discs. So she's getting a good stretch right here, just reaching out. The traditional of grabbing the toe or trying to get your forehead down to your knee is not necessary to get a good stretch. The second stretch that we're going to do is going to focus on the lateral hip rotator muscles. And so we're going to, again, stretch her left leg. She's going to bring her knee up to her opposite shoulder to stretch the lateral gluteal muscles and the piriformis muscle. The piriformis muscle is a very key muscle because it's very close to the sciatic nerve. And if that muscle gets really tight, it can actually compress the sciatic nerve and cause pain similar to that radiating pain from a disc herniation. And oftentimes, we aren't sure when somebody does have radiating pain, is it actually a disc or is it the sciatic nerve being compressed by the piriformis muscle? So she's just going to gently pull her knee to her opposite shoulder, again holding it for 30 seconds, and then she'd relax and repeat that again 3 to 5 times. And again, this is focusing on the lateral hip rotators. A second variation of this muscle, I like to call it the figure 4. Now we're just going to simply put her in a crossed leg position. And again, she's still stretching those lateral hip muscles. She can actually lift this leg up and pull back on her leg to get an added stretch. This is, again, is getting the upper level of the hamstring along with the lateral rotators, the piriformis muscle, and really giving a good stretch. This is a great stretch for a lot of our runners. These two stretches, we see a lot of tightness on those lateral hip muscles with our runners, and this is going to really target that and take stress off the low back. So we've stretched the back side and the lateral side. Now we need to stretch the front side of the pelvis. So our hip flexor muscles, our quadricep muscles, also attach onto the pelvic girdle, and if they're too tight, they can actually cause a tilting of the pelvis as well. So we want to make sure we're getting all sides of the pelvic girdle, the muscles that attach, in order to give nice neutral positioning. So in this stretch, Tiffany's stretching her left hip flexors, the quadricep up into the pelvis. Just going to get into a nice lunge position with your knee on the ground. There's 2 modifications for this. She can either start to lean forward, and that's going to stretch more the lower part of the quadricep muscle. Again, you can hold that for 30 seconds, repeat it 3 to 5 times. Or she can stay in a neutral position and not lean forward. Now she wants to roll her pelvis forward without leaning forward too much, and then she wants to contract her gluteal muscles or squeeze the glutes. And by doing this, you get more of the attachment for the hip flexor on the pelvis itself, and this is a really good stretch. This is probably one of my favorite stretches for runners. We oftentimes focus on the posterior and forget about the anterior muscles. If you want to make this stretch even more effective, you can take that same side arm, go straight up above the head, with a slight lean to the side, and that's really going to open up that front hip complex and give a great stretch to the hip flexor muscles. Okay, so now we've done our flexibility. Now we can focus a little bit on some strengthening of the core muscles. So we talked in the discussion portion how we really want to avoid the rounding of the back. A lot of our research is showing that we need to focus more on the back muscles themselves and not so much on the ab muscles. So what we're going to show here is a progression of an exercise called the plank. So Tiffany's going to start off in the very early stages by doing a plank simply on her knees. So she's going to get down on her knees and then on her elbows. The big focus here is she wants to draw her belly button towards her spine. That's going to contract that transverse abdominis, that internal weight belt that we discussed in the other segment. The other thing is she wants to make sure she stays as neutral as possible. She wants as straight of a line as possible through this motion. Now, what you can do is start with a 10-second hold and then progress up to a 20-second hold and finally up to a 30-second hold as you get stronger. It doesn't look like it's that strenuous, but you'll find when you get down here, your back muscles and your core muscles really start to burn with this very simple exercise. And once you feel very comfortable doing the plank on your knees, you can progress to the next level, which is a traditional plank, which is up on your toes and on your elbows. So Tiffany's going to go ahead and assume that position, get off her knees. Same thing here, we're going to keep a nice straight line between her shoulders, her glutes, all the way down to her legs. She doesn't want her bottom sticking up in the air. She doesn't want her back to sag. And the way that we accomplish this, again, is to draw that belly button in up to the spine. You want to contract that core, and that's going to keep your trunk nice and level. And if we want to modify this even more, once you get the traditional plank down, you can add more stresses to it by simply alternating a side step with the plank, maybe 5 to 8 on each side, alternating like you're walking to the side. And that's going to give you even more of a stress and more work and exercise done and strengthening for your back muscles and your abdominal muscles. And then for the final progression, and when you really feel comfortable, if you've got a Swiss or stability ball around, you can actually add that to your plank motion. The stability ball is going to really tax your core. You'll find that again, it's going to look like a rather simple exercise, but once you get up onto your elbows on the ball itself, the ball starts rocking a little bit. You're really going to have to work hard with your core to maintain that straight line. Go ahead, Tiffany. So again, same general principles. Contract the abdominal muscles by pulling your belly button to your spine. Nice straight line. She's doing a great job right there. We don't want the back to sag or the bottom to peak up in the air like we're going into a pyramid form. So she's holding this nice long line, again, progressing from 10 seconds up to 20 seconds and then finally up to 30 seconds. So hopefully today you've seen a few flexibility and strengthening exercises that you can incorporate into your fitness routine that can hopefully strengthen those back muscles, stretch out, make nice and flexible and pliable your lower extremity muscles to prevent any back injury from occurring. Obviously, before starting any of these, you'd want to consult with your physician, especially if you've had any back injuries before, to make sure that you're not overdoing it or starting something when you've got an underlying condition. But these are great things that you can add in. Don't take much time. You don't need hardly any equipment whatsoever. And you can get this into your routine so that you can get outside and enjoy your activities without worrying about any underlying back conditions or suffering from one of those back conditions that we've talked about.